Hello, my name is Dr. Ibrahim Victor Mainga. I'm a medical doctor and a general practitioner in a general hospital in Niger State, Nigeria. I'm also a student of diploma MSc University in Diabetes Medicine, University of South Wales, Cardiff City. In this video, we'll be discussing the macrovascular complications of diabetes mellitus. As a way of introduction, diabetes mellitus is a chronic metabolic disease characterized by hyperglycemia resulting from abnormal metabolism of carbohydrate, protein, and fat, and due to relative or absolute deficiency or absence of insulin secretions. Diabetes mellitus increases the risk of macrovascular disease by about 2 to 4-fold. And more than half of patients with diabetes mellitus are at increased risk of dying due to complications, macrovascular complications such as cardiovascular diseases. Macrovascular diseases can be classified into transient ischemic attack or stroke when they affect blood vessels to the brain. Can also be classified into coronary artery disease, which is a spectrum of diseases ranging from stable angina to unstable angina to myocardial infarction when they affect the heart. And also it can also be classified into peripheral arterial diseases. The etiology of this disease is attributed to a large extent to formation of atherosclerosis, which is the hallmark in the pathogenesis of macrovascular disease in diabetes. Atherosclerosis results from insulin resistance or hyperglycemia that leads to increase in oxidative stress, increased activation of protein kinase, increased activation of advanced glycated end product. How will this patient present? Presentation depends on the systems that is affected. When they affect the brain, they will present with features of transient ischemic attack, which is a milder form of stroke characterized by sudden neurological deficit, usually lasting for minutes, less than 24 hours. When the neurological deficits last more than 24 hours, is termed as stroke. And such patient may present with sudden loss of consciousness. They may present with lateralizing sign, present with slurred speech, present with visual impairment, present with abnormal gait, depending on the part of the brain that is affected. Peripheral arterial disease could present with intermittent claudication, which is severe calf pain that is usually exertional pain, relief with rest. Could also present with ischemic ulcer. How will we diagnose patient with macrovascular complication? Putting the history and the clinical findings, one could go ahead to make confirmation of these diseases. The use of CT scan, MRI has been helpful or is helpful in making diagnosis of confirming diagnosis of stroke. CT scan help to localize the arteries involved. In peripheral vascular disease, simple investigative tools such as or screening tools such as ankle brachial pressure index is very helpful. This is cheap and simple and easy to use. Can be used in confirming diagnosis of peripheral arterial disease. However, in diabetes, because of atherosclerosis, the elasticity of these vessels are lost. So the use of ankle brachial pressure index may not be reliable. As such, other investigative tools may be helpful, such as the use of Doppler ultrasound scan, the use of magnetic resonance angiography, the use of computer tomography angiography. This may help in assessing the patency of these blood vessels in the peripheral vascular system. Management. The management of macrovascular disease usually multidisciplinary, involving endocrinologists, neurologists, cardiologists, and other fields when indicated. The management of this macrovascular disease could start from simple lifestyle modifications such as dieting, regular exercise, cessation of smoking, avoiding or reduction in alcohol consumption, or targeted or specific treatment to hyperglycemia, hyperlipidemia, hypercoagulability state, and hypertension. The aim is to reduce hypertension, reduce lipids, serum lipids, and reduce the blood glucose level, and then improve the patency of these blood vessels. It will be worth to mention that there are some preventive measures that should be taken to improve this cardiovascular disease outcome. One of such is the use of aspirin and statins. Aspirin, even though very important in prevention of cardiovascular diseases, should be discussed with patients if it should be used in primary prevention because of the increased risk of bleeding that is associated with its use when indicated. In conclusion, diabetes mellitus predisposes to macrovascular diseases. As such, early screening, appropriate referral, and prompt treatment will help to reduce the morbidity and mortality that is associated with these macrovascular diseases. Thank you.